My name is Megan White and this is Tammy Morris. Today we're going to be telling our audience about self-examinations for breast and testicular cancer. Our audience today includes Tammy's 3 boys. This is Brennan Morris. We have 2 on this side. We have Cameron and Ian Morris. And also my sister, Caitlin Todd. Alright guys, ready to learn about some self-examination. So first we're going to start with the breast exam. Let's see. Okay, so we want everyone to know that a self-breast exam should be performed at the same time each month. So we like to have our people pick one day of the month and to perform that exam then, but also if the female is on her period, then we tell them to wait at least 1 week after it ends to perform it. For the postmenopausal females, and this isn't applicable, then you want to pick a day each month and then just be consistent with that. Lastly, we want to look for lumps that resemble frozen vegetables, such as your peas and lima beans. Our next slide. So, what are we gonna use to start this off? We're gonna be using the pads of your fingers when examining your breast, and we're going to be checking for hard lumps, but just regular lumpy areas on the breast are very common. So it's important to know your baseline or what's normal for you before. So some signs of abnormal findings include sudden nipple discharge. This can be different colors such as red, clear, yellow, or brown. So this is obviously not the normal for anyone, so I want to make note of those things. Also, any type of unexpected redness, swelling, dimpling of the skin irritation, itchiness, and any type of rash as well. And not just, we don't want to limit it to just the breast. We want to also check underneath the collarbone as well and around that area. So whenever we are doing the self-breast examination, also look for changes in the breasts. Are they the same size? Are they symmetrical? Do we see any darkening of certain areas of the skin? Do we see any of these, any spots that look abnormal? And if you do, while performing it on yourself, then make note of that and tell your doctor about it, because that's very important for them to know as well. So step 1, we want you guys to just be standing in front of just a standard mirror, and examine yourself. Do you see anything abnormal? Check for symmetry. Check that for the size issue. Look for any type of things that just aren't normal for you. Anything new or changing. So here is just a diagram of how to perform a self-breast exam on yourself. So we're going to go through these steps now. 1 second. Okay, so right now we're going to be using 3 positions to check for dimpling. So we're going to put your hands on your hips. And whenever we do this and then we're going to lean slightly forward. So the reason we're doing this is that whenever we pull our shoulders and our elbows forward with it, then that's going to allow us to, as we use that squeezing motion, to check for any dimpling in that breast tissue, okay? So that's very important to note, because that is one of the signs or abnormal findings for breast cancer. Step 3, you can raise your arms and rest your hands behind your head. And while you're in this position, be checking, feeling, and looking for any abnormalities there as well. Step 4, you're going to put your left hand on your waist, okay? Let's see, yes, left hand on the waist, and then roll your shoulder forward and reach under that underarm area and the tail of Spence, which is like right there, and the bend right next to your underarm. And whenever you're in this position, we have lymph nodes, especially around the collarbone, but also down here by our armpits. So be feeling for hard nodules. Lymph nodes can be swollen as well whenever we're sick. So, to kind of feel around and see, does this feel normal? Is this new, abnormal, and so forth. As you go from the tail of Spence area, also walk it back up around here to the collarbone, around and underneath those things too. And then you're just going to do that, the same thing as we just did on the other side. Okay, now we're going to raise our left arm and use the pads on our right hand to examine the left breast, okay? So using 3 different pressure levels, we're going to do light, medium, and firm. And you're going to palpate all 4 quadrants with this. And there's 3 different pattern sets. You can either do it, they're like the lines, you have circles, or you have wedges. So lines, whenever you're palpating, we're going to be going up and down. That's the lines that we talk about. Circles, you're going to go in a circular motion all around the breast, and then the wedges out and in and out like that around the breast as well. Once again, feeling for any abnormal nodules and so forth. Okay. Lastly, you can also lie on your back, and this is really good, especially for those of us that have maybe, you know, we're more endowed up top, and so we lie on our back, and you can put your left arm over your head, and then, you know, have a pillow or a folded towel under your shoulder blade, and kind of lift up here. And then this is just going to help flatten out that breast so you can really feel and, you know, be able to pinpoint something that's abnormal a little more easily. Okay. And we also want you guys to know that sometimes it's easier to feel and really move around that tissue if you use lotion, but you can also perform a self-breast exam in the shower. So that is how you do a self-breast exam.
Okay, my part. I'm going to tell you how to do a self-testicular exam. Yeah. Testicular cancer is most prevalent in males between 20 to 35 years of age. However, they can occur anytime after the age of 15. Caucasian males are more prevalent to getting testicular cancer than African Americans. It's 4 times more likely. And what you're wanting to look for, any abnormal findings, is going to be, of course, your lump, a pain in the testicle, the change in the size in one of your testicles, or a feeling of heaviness or a feeling of fluid on your testicles. Okay, and this is just a picture of a self-testicular exam where you're using both hands to grasp the testicle and rolling that testicle in between the thumb and first finger. And of course you're doing this gently and you're feeling for lumps and nodules. And then both testicles are done the same way. First thing you want to do is stand in front of a mirror and look and see if there's anything going on as far as swelling. Is there any changes in your skin? How's the hair distribution? You're also looking at your urethral meatus to see if there's any discharge, the location of your urethral meatus. Any pain in the penis or masses also needs to be examined. And then you begin examining each testicle with both hands, and like I said a while ago, you just roll your testicles in between your fingers gently and feel for any changes. Is one of them larger than the other one? Is there any pain? Is there any lumps? And they can feel anywhere like a grain of rice to like a seed or a small pea or something. Okay, the epididymis is located on the top and back of the testes. You don't want to confuse that for a lump. It's going to be a little bit softer feeling than the rest of the testicles. So you need to be familiar with the feel of that, so then you're not going to confuse that with a lump. If any changes are noted, you need to contact your provider with any findings that you have, any concerns that you have.
All right, so we want to go ahead and ask our audience if they have any questions. But first, regarding the self-breast exam, Caitlin, can you tell me, for you, when would be the best time for you to perform a self-breast exam?
From what you all told me, 1 week after once a month, whenever my period is ended, about 1 week, and try to stay as consistent as I can concerning that day. Yes. Every month. So.
Awesome. And Tammy, do you have any questions for the boys?
Yes. When would be the best time to do a testicular exam, Brandon?
In the shower once a month.
Once a month. And the reason why he said in the shower, I forgot to mention that, is that a warm shower, you're not only is your scrotum warm in the shower, but your hands are also, and that's the best time to do a scrotal exam.
All right, guys. All right. Well, thank you for listening, and we hope we taught you something today.
Thanks.